Hi, my name is Jonathan Marino, and I'm an athletic training intern from Western Illinois University. And today, I'm going to be talking to you guys about the acronym PRICE. PRICE stands for Protection, Rest, Ice, Compression, and Elevation. And it's used as a guideline to help manage acute injuries. An example of an acute injury is a sprain, strain, dislocation, fracture, or contusion. Protection refers to applying an apparatus to shield an injury. For example, a walking boot. It's important to protect your injury so that you don't cause any further damage to it. And generally, an athletic trainer will give you some sort of protection apparatus. Rest refers to restricting an injured body part from all activity. It's important to rest an injury because any movement or forces acting on an injury will slow down the recovery process. A common apparatus to help with rest are crutches. And today, I'll show you how to fit, walk with crutches, and go up and down stairs with crutches. Okay, this is how you fit someone for crutches. First, what you're gonna do is you're gonna ask them their height, 5'7". All right, 5'7". You're gonna take the crutches, make sure that they're at the correct height setting. Then you're gonna ask the person to lift their arms up. You're gonna put the crutches underneath their armpits and make sure that the bottom of the crutches are 6 inches out and 2 inches forward. So a good way to tell that, for 6 inches out, you put your foot in between their foot and the crutch. And then for 2 inches forward, you just guess. Then you're gonna have them put their arms down. You're gonna have them bend their wrists to see if the handles are at the crease of the wrist. In this case, they are. Then you're going to tell the person to grab on to the handles and support themselves through their hands and not to rest their armpits on the top of the crutch. And then you take your 2 fingers and see if you can fit 2 fingers in between the armpits and the crutches. This is how to walk with crutches for non-weight bearing. What you're going to do is you're going to step forward with the crutches about a foot and then swing through, and then you're just going to repeat after that. Swing through, step forward a foot, swing through, step forward, swing through. This is how you go up and down the stairs non-weight bearing. What you're going to do going up, you're going to get close to the stairs and you're going to lead with your foot followed by the crutches. Good. Next, foot, crutches, foot, crutches, foot, crutches, foot, crutches, foot, crutches. Now going down the stairs, you're going to turn, and it's the opposite. You're going down first with the crutches, then the foot. Crutches, foot, crutches, and you're going to have your foot hanging forward and not back. Crutches, foot, crutches, foot, crutches, foot. Good. This is how you walk with crutches, weight bearing. What you're going to do is at the same time, you're going to step forward about a foot with your bad foot and the crutches at the same time, followed by the good foot. Good. 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 This is how you go up and down the stairs, weight bearing as tolerated. What you're going to do first, you're going to step up with your good foot, followed by your bad foot and crutches. And repeat. Good foot, bad foot, crutches. Good. Repeat. Repeat. Good foot, bad foot, crutches. Good foot, bad foot, crutches. Now on the way down, it's the opposite. You're going to go crutches, bad foot, good foot. Crutches, bad foot, good. Repeat. Good. Crutches, bad foot, good foot. Keep going. Good. 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 Ice refers to applying any kind of cold therapy to an injured body part. An example would be an ice bag, a chemical pack, or an ice bath. It's important to ice an injury because it helps with the swelling and pain. I'm going to show you some tips and educate you on how to ice. Here's some ways to ice at home. One way is to take a plastic bag and fill it with some ice. Make sure that the ice is crushed so that the ice bag molds better to your injured body part. Another way is to take a frozen bag of vegetables and ice that way. Whichever way you use, make sure that you wrap it in some sort of towel. Compression refers to applying a compressive wrap or sleeve to the injured body part. It's important to compress your injury because the compression helps push the swelling away from the injured body part. This is how you apply an ACE wrap with an ice bag. What you're going to do, the person that's getting their ankle wrapped, they're going to take their foot and hang it off the edge of a table. Then you're going to push the foot back so that the ankle's at a 90 degree. Then you're going to take your ice bag and apply it to the injured site. For this case, we're going to pretend that the person sprained the outer portion of their ankle. Apply the ice, have the person hold it, and then you're going to start the ACE wrap at the midfoot. Make sure you don't start too tight, and then you're going to work your way up the ankle. You're working your way up so that you push the swelling away from the injury site. And as you're working your way up, you're making sure that you cover your tracks by 1/2 the width of the ACE wrap. And once you get to the top, once you finish your wrap, you're going to take the toe and squeeze it, and you're going to see if the blood rushes back to the toe. If the blood rushes back to the toe, that means that the ACE wrap is on not too tight and that the circulation is good. If the blood takes a long time to return to the toe, or it doesn't at all, then that means that the ACE wrap is on too tight and that the circulation is cut off. Also remember that you should only have an ACE wrap and an ice bag on for 20 minutes. Don't have it on all day and don't sleep with it overnight. Elevation refers to lifting and maintaining the injured body part above the heart level. It's important to elevate the injured body part because gravity helps push the swelling away from the injury. Here's an easy way to elevate an injured body part at home. All you're going to do is take a few pillows and stack them on top of each other. Then you're going to take the injured body part and lift it onto the pillows, making sure that the injured body part is above the heart level.